We were able to design this eye clinic from the ground up. We were able to decide how many examination bays we need, what sort of equipment would we need when examining the patients. So we've designed our training clinic in a way to bring them into having advanced practice as standard. Ultimately, we really want to provide that comprehensive eye care service to our patients, the best quality of care to try and, one, help the local community, and two, help our students develop into the next generation of eye care practitioners ready for that advanced practice, ready for the development and evolution of our profession.
This is just a really exciting development for the university because we already provide services into the community, for example with our dental academy and so on, and actually this was a natural thing for us to do, especially considering there is a shortage of qualified optometrists in the region and in the city. So we have invested around £2.5 million in this facility, but it's so important that the students have the very best of equipment, that they also have access to the kind of equipment that's used in practice that they will experience.
So far we have clinics 4 days a week, and we've been seeing patients for OCT, visual fields. We've actually gotten a Optomap, so we've been able to take retinal images. And we also just do regular sight exams and contact lens fittings.
We have 9 testing bays. Of those, 4 are dedicated in the direction of contact lenses, and the remaining bays are dedicated towards routine sight testing. We also have a 6-metre bay, so that's a full-length examination bay, which gives us that extended scope of potential practice, especially with the younger children who have accommodative anomalies and can sometimes relax with accommodation. It gives us that alternative to the first movement towards psychoplegics. So in addition to our standard threshold and suprathreshold visual fields and intraocular pressure testing, we have an Optomap ultra-wide field imaging system. We also have a swept source optical coherence tomographer. So we have those sort of advanced diagnostics as well. We additionally have certain instrumentation for the detection and management of binocular vision anomalies. So we have a dedicated orthoptic training kit. We have a synoptophore for both diagnostic and training for orthoptic techniques. As well as that, we have a colorimeter for the diagnosis and prescribing of lenses to alleviate visual stress on the patients. Within the sight testing bays, all sight testing bays are set up with this digital ready slit lamp. They have the trial lens case as you would expect in a standard practice. Those bays that are dedicated towards contact lenses will be either have a keratometer or corneal topographer within them, and those that are dedicated towards eye testing will have the phoropter set up as we have in this room. Pre-screening is undertaken by a student, and typical pre-screening will include peripheral vision testing, intraocular pressure testing and retinal imaging. The patient is then taken back to the waiting area and called through by a separate student in for the main examination that they're doing. Each examination room is set up with a digital slit lamp system, so we are able to image through the slit lamp itself. And the way that we use this system is twofold within this facility. We use the system as a recording tool. What it is also useful for is a training mechanism. We can use the camera as a closed circuit system, which enables us as supervisors to sit back and look at the screen sat above the student's head, and so we can observe what the student sees through the eyepieces as they're undertaking an examination. And so from a teaching perspective, that allows us to gain that feedback mechanism to the students. So we can identify if they're going wrong, we can identify if they're doing well, we can give them guidance on how to improve technique and how to modify to get the best possible imaging. What we're very keen to do is train our students to be functional with all the various pieces of equipment that they get in practice. Often there can be a risk of students getting very used to one piece of equipment and not being able to fluidly move to another piece of equipment should they, say, be employed in a practice that works in a short form test room. So it's really about preparing the students for that future practice of what they might come across when they meet community practice.